My name is Dr. Olujimi Coker. I'm a consultant gastrointestinal and laparoscopic surgeon and the managing partner at Sapphire Surgical Centre in Victoria Island, Lagos. So a colonoscopy is a small tube with a camera at the end of it. The images are projected onto a screen so that everybody can see what the pictures look like. There are several reasons why we need to do a colonoscopy. Majority of patients will have colonoscopy to investigate a problem with the large bowel. The commonest being blood in the stool, or what we call rectal bleeding. Another problem is pain, where the patient will complain of abdominal pain in the lower part or the middle part of the abdomen. Thirdly, if a lump is felt in the abdomen that we suspect may be originating from the large bowel, then we will also need to do a colonoscopy. Regarding the age at which one can have a colonoscopy, there are two categories of colonoscopy: the investigative part and also screening. With regards to screening, the standard guidelines now relate to the importance of identifying polyps. Polyps are overgrowths in the large bowel that, if left alone, may become cancerous. And majority of people will need to have the first test at the age of 40 or 45, depending on the region. In sub-Saharan Africa, where colorectal cancer unfortunately occurs 5 to 10 years earlier than in the West, then we will normally recommend starting screening at the age of 40. For people who require investigations of symptoms relating to their large bowel, then a colonoscopy can be done and should be done at any time. So this really depends on the needs of the patient. The importance of colonoscopy relates to identification of problems in the bowel. And these problems could either be as a result of inflammation, which we refer to as colitis, or it could be as a result of a growth. And the growth could either be benign or malignant. The other problems could be narrowing of the bowel as a result of infection or to investigate pain. Any of these, we would need to perform a colonoscopy. The most important condition that we are looking to prevent will be colon cancer. That's because we know that if we catch colon cancer early, 9.5 out of 10 people will be cured from the condition. Unlike if colon cancer is picked up late, then the risks to life are quite significant. So the sooner the cancer is picked up, the better. So picking up colorectal cancer will be one important aspect. The other important aspect relates to bleeding, investigating patients who have bleeding or who have diarrhea or who have constipation. The other category will be people who complain of abdominal pain. Unfortunately, one of the biggest complaints of patients who come for colonoscopy is the bowel preparation that needs to be done the day before. The bowel preparation is important because it clears the large bowel, that is the colon, of waste matter, which we also refer to as stool or feces. If we do not clear the bowels, then it will be virtually impossible to investigate the colon with the camera. So the patients will need to take a form of laxative that will clear the bowels. And at Sapphire Surgical Centre, we have ensured that as much as possible, this unpleasant experience is minimized. Patients will have a polyethylene glycol-based fluid which stimulates the bowel, and this will be done the day before in the evening, say between 6 and 7 o'clock, and then the following morning, 5 hours before the procedure. This our patients find pleasant. I know that in some places the bowel preparation could be up to 3 days where the patient is fasted. This, in our experience, is unnecessary. So the patients will, as much as possible, still be able to eat up to midday before the examination. We, however, restrict what can be eaten so that roughages, high fiber diet, anything that will color the stool red or will stimulate the bowel is avoided. In order for patients to tolerate the bowel preparation, what we need to do is to reassure them, to say, listen, what you're going to take will not cause any pain. And people are concerned about getting excessive diarrhea that can be painful. That's not necessary because the fluid is quite gentle. It will empty the bowel, and because we have ensured that patients can eat up until midday before the examination, then they do not feel faint because they haven't eaten, and we encourage patients to drink as much as possible. So you can drink any fluid that you like. Say if you're somebody who likes to take fizzy drinks, you can have Sprite, you can have coffee without milk. So fluids that do not contain milk or sediments in them can be taken up until 4 hours before the procedure. So that way patients don't feel faint because of low blood glucose. And in addition to that, the bowel preparation, the product that we use does not cause pain. So patients will normally arrive in the morning and are seen by the nurse who would take their vital signs. What do I mean by vital signs? Their temperature, their pulse, the blood pressure, to ensure that all is well. Then the doctor would go through the history again to ensure that there are no reasons why the patient cannot have a colonoscopy. Then I would see the patient, talk to the patient, take an informed consent, explaining the reasons why the procedure needs to be done. I will also explain the benefits of the procedure and the risks associated with the procedure. The risks are very minimal, and in experienced and expert hands are virtually nil. However, no procedure is risk-free, and that will normally be explained to the patient. Once this is done, we take the patient to the reception in theater where they get changed into the theater gown, and once they've taken the consent, they have an intravenous line put in, because we would normally give sedation to try and calm the patient down and ensure that the procedure is as pleasurable as possible. Once that is done, the patient walks to theater and we do the procedure. Once the procedure is done, the patient returns to the recovery room where time is, we allow the sedation to wear off. And once the sedation wears off, then the patient goes back home. We would normally advise that when the patient is coming for the procedure, they should not drive down, because following the procedure, if sedation is given, then the patient should not drive, operate any machinery, or sign any legal documents within 24 hours of the sedation. The commonest concern of patients who have colonoscopy is pain. And I can assure you that colonoscopy is not a painful procedure. There are twists and turns in the large bowel which an experienced colonoscopist would navigate quite easily. And what I explain to patients is that a colonoscopy is as good as the person doing it, not the facility, not the equipment. It's important to have an experienced person who is aware of the risks that can be associated with this procedure and ensures that we call the technique talk steering, navigating the colon and the twists and bends and removing any loops that can be formed, because it's the formation of a loop that causes pain. And if this is identified and removed, then colonoscopy will not be painful. In fact, some of my patients have described it as pleasurable. Recovering from colonoscopy is fairly straightforward. For example, I did a colonoscopy this morning at 10:30 and the patient left the hospital at midday back home, having fully recovered from the procedure. Recovery can be delayed if there is excessive sedation. Excessive sedation usually occurs in patients who cannot tolerate the procedure because of pain or because of anxiety. As I had explained, if an experienced colonoscopist is doing the procedure, ensuring that there are no loops, ensuring that talk squaring takes place properly, then there shouldn't be pain, and such patients will therefore not need to be over-sedated. So part of why patients need to stay in hospital longer than normal is if there has been too much sedation given. The beauty of colonoscopy is that even the patients, if awake, can see the camera, they can see the screen to view what the colon looks like. By the end of the procedure, we will have a result. The result will then be printed or electronically delivered to the patient, either by email or WhatsApp message. We would normally include images of the procedure, of images of the colon in the report. There are very few contraindications, if any, to having a colonoscopy. Certain ones include if a patient has had a recent heart attack or a stroke, then the patient will be advised not to have a colonoscopy. In the case of a heart attack, at least 3 months should elapse before a colonoscopy, and in the case of a stroke, 6 to 12 months. Certain types of medication also make colonoscopy difficult or at times impossible. This is because particularly patients who are on blood thinning drugs, which could include clopidogrel or warfarin, it will be impossible, or there are risks associated with taking a biopsy, and it may be necessary to take a biopsy. Because of this, we would normally advise patients who are on blood thinning medication to stop the medication for 5 to 7 days before the procedure. Thirdly, are patients who are on iron tablets. These tablets will color the stool black and make the stool black and tarry, which affects the quality of the bowel preparation. So again, we will normally advise patients who are on iron tablets to stop the iron tablets at least 72 hours before the procedure. In addition to that, patients with severe inflammation of the bowel, either because of acute diverticulitis or because of severe inflammatory bowel disease, for such patients, colonoscopy will usually be deferred. In emergencies, however, one may still need to perform what we will refer to as a gentle colonoscopy, ensuring minimal insufflation of air into the bowel, but this should be performed by a very experienced colonoscopist. The commonest myth and the funniest myth, I suppose, is when I was managing a family of patients with what we call familial adenomatous polyposis coli syndrome. And the family believed that doing a colonoscopy usually causes cancer. So for such patients, they were extremely reluctant to have the colonoscopy. That is one extreme, but majority of patients, their biggest concern is pain. Some are worried about the discomfort or the inconvenience of taking the bowel preparation the day before the procedure. The other risk, of course, is with patients coming to harm. And my advice will be that patients should be very careful in selecting where they go to have their colonoscopy. As I had earlier explained, it's important to seek an experienced colonoscopist to go to a center where this is done regularly and not done occasionally, because the skills required would usually improve as one does the procedures regularly and more often. My advice to anybody having a colonoscopy is that there is nothing to fear. What is important is to identify a center like Sapphire Surgical Centre and ensure that the person that is going to do the procedure is fairly well experienced. And I will again reiterate that a colonoscopy is as good as the person doing it, because one needs to ensure that it's an experienced person who is not doing it for the first time and has been properly trained, is aware of the risks and possible complications that can occur and mitigate against this. Also, with the staff that are well practiced, well versed in ensuring that everybody works within a multidisciplinary team that will result in excellent outcomes. So if you want to learn more about colonoscopy or you want to book the procedure, then you can visit us at Sapphire Surgical Centre, 7B Ojuolobun Close, off Adeola Odeku and Ijejo Streets in Victoria Island. You can also visit our website, www.sapphiresurgeons.com, or on any of our social media handles, which are now at the bottom of the screen. You can also contact us on the phone line at the bottom of the screen. At Sapphire Surgical Centre, you are in safe hands.